we found that, surprising to us and many others, that what we'd assumed to be this mental health disaster tsunami wasn't happening.
A new study suggests the first year of the COVID-19 pandemic took a limited toll on global mental health, contrary to what many may have thought. Canadian researchers reviewed 137 studies from around the world that measured people's overall mental health, as well as depression and anxiety levels before the pandemic, and then again during 2020. They found that mental health hadn't gotten all that worse despite the crisis.
The pandemic was messy. It meant many different things for many people. People have suffered tremendous losses. They were under great pressures. They were isolated, and many people did experience mental health changes that were very negative.
Changes at government levels, changes at work levels, in family. You now may have kids at home they're not caring for, trying to sort out Zoom school, financial changes for many individuals. So these are factors that typically impact mental health. At the same time, we were pretty thrilled to learn that overall there was some resilience, some pretty strong resilience, and some strong coping skills that people used.
Dubbed the world's most comprehensive study on COVID-19 mental health, they studied 134 cohorts of people, 3/4 of which were adults, including some with existing mental health disorders. Did the pandemic affect your mental health?
I think it did, yes, obviously, because we couldn't see anybody. The main thing that I saw was during festivals. Before pandemic, it was mostly in the crowd, having fun. Now I'm a little bit more scared being in the crowd.
A little bit, in the sense that you're more lonely, you're thinking a little bit more about your stuff, so sometimes you maybe feel a little more depressed, but in terms of overall, I think it actually made me a little bit stronger, in the sense of like I can deal with stuff a little bit better.
My mental health was not affected by the pandemic. Even if it was electronic, we always had an exchange with friends. My mental health was not affected too much. The study, however, did find women experienced a decline in mental health, with a slight increase in anxiety and depression.
Women often take on many responsibilities or have many responsibilities, both childcare, elder care, managing many tasks both at home and at the workplace.
While many had different experiences, the researchers say the study's results are reassuring.
If you find yourself in an ocean, you learn to swim. And I think, we did find ourselves in an ocean, and many people learn to swim.
In Montreal, Alyssia Rubertucci, City News.